We're live.
We're live?
Yeah, you can.
Okay,
Yeah.
perfect. I'll start. Hello, everyone. We have a very special guest with us today on our webinar, brought to you by Anna Jury in collaboration with Sesta. I'll just kick off with a brief introduction of what Jury is. So we are basically a social platform looking to bring together people who have been working for social and environmental change in Assam. Our intent is to create a platform where they could come in, exchange ideas, and create a network of change makers. That is like our brief thing. We have been conducting seminars, webinars actually almost every day with people from various social fields. And today we have a frontline COVID worker with us. I'll kick it off to Mridhu to give a brief introduction of what Sesta has been doing.
Thank you, ma'am. Good evening, everyone. I'm Mridhu Deka on behalf of Sesta. Welcome you all to this health session, our weekly Monday health session. Sesta jitu organization hoi ma kam kori ahisu tar bikha okoman kom moi kobole chesta korim. Sesta is an organization which works for health, works for society, for empowerment, and for social transformation actions. Awareness programs, flood relief camp, এইবোৰ পাত্ৰা মানে organize কৰি অহাৰ উপৰিও বিভিন্ন সময়ত যিবোৰ আমাৰ social taboo থাকে, social taboos, then অন্ধবিশ্বাস যিবোৰ মানুহে বিশ্বাস কৰি আহিছে বহু বছৰ ধৰি, এইবোৰ ভাঙিবলৈ বহুত সময় in every possible way চেষ্টা কৰি অহা হৈছে। আৰু এতিয়া আমি from a month now, we have joined hands with Anajori and organizing webinars on this health issues, health session as a health session on Mondays. গতিকে আপোনালোকৰ সাপোৰ্টত আমি ইমানখিনি কৰিবলৈ সক্ষম হৈছো আৰু আগলৈও হয়তো আমি আকৌ এনেধৰণে webinar organize কৰি যাম। আৰু আজি আমাৰ মাজত already ma'am said that Dr. Nilofar Rahman ma'am is with us. Ma'am, we are very honored to have you here with us. And I formally welcome you.
Nilofar, please. Dr. Nilofar will suffice here. Thank you. Thank you.
She is working in GMCHS psychiatrist. During this pandemic, she is working as a frontline worker. And I would like you to share your story with us. Apni kenedore work kori, mane kenedore apni deal kori ahise notun jitu এতিয়া আমাৰ কি হৈছে actually mask লৈ ফুৰো আমি sanitizer social distancing this is our new terms in our life. This is the new normal as everybody is saying. গতিকে এই new normal তোৰ লগত আমি কেনেদৰে আমি cope up কৰিম in future we have to deal with this new normal, so তাৰ লগত আমি কেনেদৰে cope up কৰি চলিম কেনেদৰে আমি deal কৰিম তাৰ বিষয়ে আপুনি আমাক ক'ব বুলি আশা কৰিলো আৰু আপোনাৰ জাৰ্নি টো as a doctor, as a frontline warrior in this pandemic, apni jodi share kore ami bhal pam. Over to you, ma'am.
Okay. Thank you, Mridhu. Yeah. So yes, I'm Dr. Nilofar Rahman, as already she said, and I joined MBBS in 2007 in Assam Medical College, and after that I completed my internship in Guwahati Medical College. Yes, in Guwahati Medical College. Aru tar pisot moi in Borpeta I served for 1 year, and after that I went to Delhi. I worked there in Sir Gangaram Hospital for around 1.5 years, and then finally I decided that I should pursue my post-graduation in psychiatry. So I joined the Department of Psychiatry in 2017, and now I'm working as a resident psychiatrist in Guwahati Medical College. Yes, so this is my journey so far in the medical field. Yeah, and about my experience with this whole COVID-19 and as a frontline warrior in this fight. So yeah, it is really not less than a battlefield for me, this whole COVID-19 thing, and in where you need to save yourself as well as others. You know, you need to safeguard others as well as to keep yourself safe as well. And yeah, I'm really glad to be a part of this quest, I must say. And yeah, I hope that this COVID-19 pandemic will go away from this world, will pass on very soon. Yeah. So my experience with COVID-19 in while I was when it was first declared as a pandemic, as a global pandemic, then we were not sure. Not every one of us was sure that what it exactly is. It first hit China, and then it spread to other Western countries. And at that time, mostly northeast part of India was totally free of COVID-19. So it was like something, whether it is a myth or a hype or what it is, we were not sure about it. Yeah, and then at that time, at the same time, I was also preparing for my post-graduation MD exam. And because of this lockdown, around 3 times my exam got cancelled, and again it got rescheduled. So it was quite a lot of stress over us as well. And finally we appeared for the exam. And while during the exam, many residents of the hostel even became positive. So that was also kind of a thing, I remember during the second, on the day 2 of our theory exam, my wallmate became positive, and then I had to go again, get all this get myself tested, and then I had to appear for the exam. So yeah, finally we appeared, and we made through it, all of us. And yeah, sorry.
Cool. Thank you so much for that introduction, Nilofar, and to hear about your experiences as a frontline worker. Let me just start off by saying thank you for all that you have been doing and all the services that you guys have been relentlessly providing. I would just like to start off with something. I was recently reading in a report from the World Economic Forum, and it said that there was a survey conducted by the Indian Psychiatry Society. And what they mentioned was that they registered about 20% more cases of mental health issues within the first month of the lockdown. So do you see that getting reflected in the work that you are doing or the cases that you have been handling? Or how is it reflected in the direct society that you have been operating in?
Yeah, it hampered a lot, both physically as well as psychologically. I must say, at times I felt that many of the patients who are asymptomatic, they were hampered psychologically more than physically, and mostly, in a country like India, where people do love to socialize, it is like difficult to bear this lockdown, first of all. And yeah, seeing the roads empty, not being able to meet each other, meet friends, relatives, this has a lot of psychological impact over us. And the things have changed a lot. Like, we are now e-socializing more than just the way we are doing now. We are more kind of e-socializing than meeting face to face directly. So yes, and moreover, during my experience, yeah, mainly I worked in the floor, in the department where they were mostly COVID positive pregnant ladies plus the post cesarean ladies. And personally speaking, I experienced that the concern about what will happen, like what about the uncertainty, what is there, like what will happen next, what will happen
Right.
when they will be retested, when after they become negative, what will happen, whether they will be able to go home, if they are going to infect the other family members, what will happen to their babies, which are not yet, which didn't even yet arrived this world. And like this kind of things, it happened a lot of things I have experienced. And moreover, some of the few examples I'd like to give, that especially in this group of population, while they are in the ward, in the hospital, like some of them gave birth to their babies, while others had miscarriages, while some others they gave birth to the babies prematurely, because of which they were kept in ICU, in newborn ICU, and some of them even died because of the complications. A few I have myself witnessed. So during those phases, like, they became very much depressed, and I could see them. They were like real warriors. I must say that these women fought for themselves as well as like taking care of the
Nilofar,
babies.
you're cutting
In the
off. Yeah.
womb. It's
Okay.
a, yeah. Like,
Can
I
you?
don't know
Yeah.
what's happening.
Yeah. Maybe it's better now if you talk again. Maybe from the last two sentences.
Okay.
No, there's still an echo, I guess.
Yeah, it is not getting, you know, I couldn't start the video again. Okay, fine. Oh, gotcha. Okay,
Yeah. You're back
where
on.
did I give? Yeah. So yes, the patient, my patients, yeah. So there were around 53 beds, okay, in my in the ward where I was posted. And yeah, that's what I felt, that mine was a different experience, I must say. They were not like only COVID positive patients. They
Yeah.
were also fighting with their pregnancy period, and at
Yeah.
the same time becoming positive. That was a very big deal. I must say that means I forgot about myself, about my worries, wearing those PPE kits, seeing them in that state and fighting with this big monster. Yeah, it was an experience.
No, yeah. I mean, thank you for that. I think update. A lot of people don't really know how it impacts every part of the society, right? I mean, you just know what is going on with you, and most of all people probably think about the people who have been directly impacted or infected. But it's just that the society is so connected. You have caregivers, you have frontline workers, people who have already been suffering from mental health, pregnant ladies, as you mentioned, the elderly. I think it's just something that is making the situation bad for everyone overall. So it's unique in the sense that no one is escaping it, right? It's impacting everyone. It's like bam, altogether in one shot. So I think just going forward from that, I think a lot of people have kind of lost their traditional connections. Generally, if you were feeling low, say in a normal circumstance, you would maybe talk to a family or friend, you would go out for a weekend and maybe
Yeah,
rejuvenate a little
exactly.
bit. And now you just don't have that. It's completely gone. And I think it's just so much more important for people to lean in together, for the community to come together and find ways to do it in a safe way. So do you have any tips or any suggestions on or any coping mechanisms for people that they can safely practice during the COVID pandemic?
Yeah, it is very important. First of all, we can socialize. There are there we live in a modern world. We can e-socialize. We can e-socialize. We can spend more time with our children or with our family. With, I can say, our family, not the extended family, the people with
Yes.
whom we live. And
Yeah.
yeah, it is important to explore our own hobbies. These are the basic tips, which helps a lot of times, that we should explore ourselves, our hobbies, and the things that we are good at. Like, if one is good in painting, in gardening, they should. The main thing is that we are losing the purpose of our life. People are losing jobs. They are not going to work. The regular things, we wake up in the morning, we groom ourselves, and we kickstart ourselves to for the day, which is not happening nowadays. This is like totally like blank. At times people feel blank. So yeah, so most important is that to maintain a routine, which helps a lot. The day routine. So waking, and many people, because of lack of work, because of lack of exercise, they are having disturbance in sleep as well. As we can see, this is the most common problem we are listening from our patients. Sleep disturbances. They can't sleep at night, or they fall asleep late. The sleep cycle is changing. They wake up late in the morning. So for that, again, the routine is important. First, we need to make a routine that we will have to sleep at this time and we'll have to wake in the morning. Even if we didn't sleep adequately at night, at a particular time, we will have to wake up in the morning, which is called as sleep hygiene. And like the basic things, at night, we should not see the mobile after a particular period of time, dim the lights, and like that. Okay. And secondly, in during the daytime, we should keep ourselves engaged, as I have said, in our hobbies and the things that and like exercising every day. At least for adults, it should be for 45 minutes, and for children, around say 20 to 30 minutes. It is important for us. Taking a healthy diet, again, it is very important. We have lost ourselves, somewhere in this quest. Like, many people stop taking care of themselves. So these things are also very important, taking care of yourself, your body, your health. At times spirituality also helps a lot. Sometimes it is said in psychiatry that many of the psychiatrists, there's a myth that psychiatrists don't believe in religion or something like that. But now recently it was found that spirituality really helps a lot, even in patients suffering from mental illness, schizophrenia, depression. Spirituality helps a lot. Yeah, so these are a few of the tips, as much as I remember. Yeah.
Yeah, I mean, thank you for that. And I think I can relate to it quite a bit because, as you mentioned, the old routine is just gone. And I think the initial phase was people were still trying to maintain that, trying to somehow keep their goals intact and thinking that, oh, this will go away in a month or two and I can come back to my normal routine. But that hasn't happened. It has continued. So I think what you have said, that adjustment and just being patient throughout this year and really rejuvenating and resetting is what should be the focus, I think. Yes, definitely.
Yeah.
Another topic that I wanted to talk about was the stigmatization, right, that is going on in society with COVID patients as well as frontline workers. We see that so much that people are scared that the disease is going to be brought home by people who have been working with patients or the patients themselves. Horror stories about how housing society is not letting people live in their own apartments. So, and that has a major, major impact on the mental health, right? Even after your physical health is improved, the fact that you were not supported when you most needed that support could really have some major impact. So what do you think about that, the stigmatization process, and how can we make people aware that this is not the time to point fingers and just be educated?
Yes. For that, I believe that first of all, education is very important. Education regarding the disease itself, and how to maintain social distancing, how to maintain hygiene, and it has its own, norms. It's like if you maintain the norms, we can avoid this disease, at our best. It's sometimes I myself felt, even after wearing this PPE kit, after wearing masks, everything, sometimes I feel that maybe it is inevitable. I myself had that feeling that if I may not bring the disease to my home, this is quite natural in this situation. And what we can do at our best is to maintain hygiene, maintain the best practices, like wearing a mask always, and sanitizing your hands, and after getting up on your car, sanitizing your hand properly. And like other methods, like you whenever you go to the market, buy things from the market, you need to keep them for a while at a place where you're not going to touch it, because it can be anywhere. Even if a person who is not detected as a COVID positive patient, he may also harbor the illness. He or she may also infect. So this is quite uncertain. This is quite uncertain, who is infected and who is not. And definitely, as as far as your question is concerned, as far as this thing is concerned, that yeah, people in the flats in different localities are like, in a way they are getting harassed, and people are concerned, more and more concerned. So for that, I believe that government and NGO people should take initiative and help the people and make them educated that this is not the way. We will have to live in this world as one. Yeah, so this is very important. This is a very important point, and we need to work on this. Yeah.
Of course. Thank you. One question, you talked about face masks, and it just struck me. I mean, there is a lot of confusion about which face mask to wear, how long do you wear it for, and what is considered a safe time for reuse. So can you touch upon that a little bit and talk about some of the basics?
Yeah. So regarding the face mask, the technique of wearing is very important. You should make it that much sealed, to that extent that it should it should create a cuff-like sensation. What can I say? Like it should get in when we inhale and out when we exhale. The mask.
Gotcha.
Okay.
Very near to your skin, basically.
The suction effect should be there, of your breath, and there shouldn't be gap, visible gap around.
Right.
And yes, N95 mask is best, but so this is very important. Again, thank you for this question. I see people wearing masks made up of clothes, but this is not useful. This is not going to help. I don't know why government is also not taking steps over this. Best is N95, and after that, surgical mask. Surgical mask also works good, quite good, giving you around 70 to 90% protection. And yes, the person who is infected, if he's wearing or she's wearing the mask, then the risk of transmission goes down to only 5%. Okay, so it is important not only to save yourself, but also not to give the infection to others. Because as we know, it is a droplet kind of air droplet kind of a spray. It causes spread of infection via air droplets. And
right.
Yeah, while coughing or while sneezing, it may go several feet away. It can drop its droplets and spread its air droplets to several feet away from you. So for that reason, it is important. And what else you wanted to know? Sorry, I just forgot.
Yeah, no problem. The other thing was, for example, your N95 and surgical masks. How often can they be reused, or if can they be even reused?
Yes, basically N95 masks can be reused. Once you wear it, you can keep it on for up to 8 hours. Okay, for up to 8 hours we can keep it, and we can reuse it after. We can also wash it. We are instructed to wash it also. Yeah. And another thing is how to keep it when you put it off from your face and you enter your house, because it has been also seen in studies that the outer surface of your mask contains maximum concentration of virus. It is the highest. It catches, because it filters the virus, right? So that is the place which is very much infected, and that's why you should keep it very, very meticulously and properly when you're not using it in your residence. You should take it off and you should hang it somewhere which is safe, like in a place where you're not going to touch the outer surface. And again, if you touch it, say for example, if you're going to touch the mask, the outer surface of the mask, and then again the inner surface of the mask and your face and your nose, then it's not going to work. So yeah,
Gotcha.
Yeah. So wearing the mask and just keeping it when you're not using it also matters a lot. Yes.
Yeah, I mean, that was an important point about how do you keep it. I was not aware of what you just said, the infection being more concentrated on the outer surface. Good to know that. Is there any best practices on disposal as well? For example, the surgical masks, if you're done by the end of the day and you're throwing it away, is there any way to do it safely?
Okay. So there are studies which prove that alcohol works alcohol definitely works against this virus. Okay. Before this, before this, there were also studies on other viruses like other flus and other viruses, and on them this bleaching powder also used to work, but for particularly for COVID-19, alcohol is best, and it should not be, it should neither be like 100% alcohol, 95% alcohol, because it will get evaporated very soon before it kills the virus. So it should be optimally at a percentage of 70% alcohol. So so you can use this to disinfect or kill the virus, and then you can dispose it. Like, so this is one of the way you can dispose. So, and any other stuff which you think that it needs to be sanitized, like anything you're bringing from outside, or we have this fear that we are bringing in things and along with it virus. So this is the way.
Okay, thank you, Nilofar. I think those are like great points that people will find really helpful. We have a comment on the chat from Krishna Nath through the Facebook Live, and he has mentioned that he has firstly said it's a good initiative and said that when we have to work in rotational shifts, we face difficulty in maintaining sleep hygiene. So, and I think he's probably one of the frontline workers, I'm assuming. So, and that's a great segue to actually what I was wanting to go to, the mental health of people who are working relentlessly, right? I mean, it's just without break. So, how do you cope up? And what tips do you have for people working on the front lines?
Yeah, first of all, it is very common because it happens to be so hectic and draining for us, and also the apprehension of infecting ourselves. This is something. So for that, again, for it depends whether the very person is doing night duty, night shift, or day shift, like that. For those people who are doing night shift, so for them it is I must say that because during that phase, say for 1 week, 2 week, whatever, during those period of time, the period of time for which we are posted for the duty, so it is inevitable. Our sleep cycle will get changed, and accordingly we will have to maintain it for that period of time. But for those people who are like who are having morning duties or daytime duties, for them again maintaining the sleep hygiene is very important. Like during these days especially, this is happening quite commonly, that we spend a lot of time on screen, right? These are some of the points, like keeping your mobile in switched off, or in a no use kind of mode, after a particular period of time at night, and not doing strenuous exercise at night. Then like taking your meal early, say for example, if you want to go to bed at 10, so you should take your meal at around 8 to 8:30, and if you're hungry, you can take minor meals later on at night. So these are some of the points. And early in the morning, and we should make it sure that even if for 1 or 2 days our sleep is disturbed, we should not sleep late till late hours. So we'll have to wake up at a particular time, and we'll have to bear this, then within the course of 2-3 days, it itself gets better. And if a person is having issues like anxiety, palpitation, worriness, excessive concern, that worries, and it keeps on coming during when we go to sleep or when we go to bed, this also happens, then we can meditation at that time works good. And there are certain exercises which are even available in YouTube, like JPMR. There is one, Jacobson's progressive muscle relaxation, which works very good, which works really well. It takes only around 8 to 10 minutes, not more than that. JPMR. So we can ourselves try on. We can try it on ourselves, as well as we can advise others, because it is just a relaxation technique which helps a lot.
Okay. Thank you so much for the tips. super important, I think, things that you have said, just to how to kind of reset really, because we have lost our old ways of doing it. Another thing I read in your bio that you work with adolescent mental health, or you're interested in that area for adolescents.
Yeah.
So, okay. So, I think for that group of people, they are suddenly, I mean, I remember when I was a teenager, like going out with friends and meeting them was really the best outlet, right? That was my coping mechanism from all the things that were going on. And now that has been completely taken away from them. Yes, they do have, I think they are more virtually connected than maybe the older generation, but even then it's probably limited. So do you have any tips for parents? How can they support their children at this time when they are not sure about their careers, they don't know if their exams are going to be held, cut off from their friends and things like that?
Yeah, for that, I believe again, it's a racing mind. Adolescence is a period when our mind races, like it's like a free wild horse, and this is a period of experimentation, which is quite like it's a phase, it's our phase, and it is important to experiment. Then only we will be able to understand that what we want. And yeah, at times the children and at this age during adolescence becomes quite rebellious, and it's very difficult to handle them
Yes.
by the parents, and even they find a lot of difficulty. So yeah, and more on the top of it, the COVID pandemic and lockdown and all.
Yeah.
So yeah, first of all, making a good bonding with this age group, and try to understand them is very important. Criticism, giving negative comments, these things doesn't work. First of all, establishing a good relationship is important. And eventually, the mostly during this period, nowadays it was found that parents cannot give time to them, because of work and other things. You got me? Yeah. So yeah, many times it happens that parents fail to give time because of their own work, because of the nowadays hectic schedule. They fail to give adequate time to the children. And this is kind of a silver lining during this COVID pandemic, that we have time for children. We should spend time with children as much as possible. And for this, like the problem that they cannot go out, yes, for this it is they have e-socialization, they have all this WhatsApp thing, this chats, but it should be also like salt. It should neither be more nor less, you understand, like nowadays children playing this adolescent, mainly busy in all this social media and all. So it is
that is very toxic too. Social media can also get very toxic.
Sometimes mostly there are we accept it, we respond in a critical way, that ei loratutu hodai mane eneke thake, ei swalitutu hodai mane she keeps herself busy in all these social media things. But at times it is important too, because this is the way I'm telling, that this is the way they now for this period of time, this COVID era, it is important to it helps them to socialize, this is important. And another again, so it shouldn't even be more. So yeah, they should be allowed to socialize via internet to some extent. Okay, so this is one of the way, but I'm trying to make you guys understand. I hope I am able to.
Yes,
and
definitely.
And more than that, exploring one's hobby, as I have already said, exploring one's hobby, and in which area one is good. Somebody is good in singing, someone is good in writing, in whatever. Some children, maybe they find it very interesting to bake and to cook, gardening, keeping pets. So yeah, they should be allowed to explore, adjusting themselves to this this particular period, like COVID period, like, you know.
Yes. Yeah, I think that is a great point because traditionally the entire focus is on your academics, right? And I think parents, at least during this time, should definitely make an effort to kind of reduce that level of stress because it's not normal for anyone. So they are struggling and they are struggling more even now. So yes, definitely. I think
Yeah.
letting them do things that where their natural abilities lie and practice tools can really be beneficial. Definitely.
Yeah.
Thank you. That's a great point.
And yeah, really, one more thing I want to add, that, you know,
Yeah.
study academics is important. Definitely, there is no doubt over that. But ultimately, even if you are good in studies, you get a good job, you get a good business of yours, it is very important that you should know how to socialize and how to adjust with people. And these are some of the qualities that we gather not via academics, but via socialization, the leadership
Yes.
qualities, you know, how to work under others or how to lead others. So these are some of the
Yes.
qualities that we can that we can acquire only via socialization, talking with people, interacting with others, you know.
Yes.
So yeah, exploring ourselves, our interests,
Mhm.
our talents. Yeah,
Yes.
that's why it
I
is
mean, I 100% agree with you. And it's such a vast topic. We can have another webinar with you just
yeah.
about how adolescents should be allowed to, go forward. I have another message, and it says that after so many suicide cases during this pandemic, do you think the stigma on mental health would reduce as this is being talked about everywhere? Great question.
Yeah, yeah, it is quite a controversial question because, you know, mental health is always an area, a field which remains in a lot of which entertained a lot of controversy. You know, that
Yes.
it's a
Yes.
myth. Mental illness, it's a myth. क्यों क्यों
Yeah.
किसी का मन खराब हो सकता है? He or she can take care of himself. We are all doing good, so he should also keep himself, you know, up to the point, up to the mark.
Yeah.
So yeah, during this phase, since along with the COVID surge, there is also a surge
We lost you, Nilofar. Hello?
sorry, I again got
Oh, okay.
disconnected.
And that's fine. You're back
Am
now.
I there? Am I
Yeah.
there?
Yes. Yes. Yes.
Yeah, like OCD is kind of a I want to share one or two points about it. It's a kind of a condition in which a person gets overtly concerned about different things like cleanliness, hygiene, repeated unwanted thoughts coming in one's mind, you know, even after knowing that these things are coming in my mind to the extent which is not justifiable, you know, something like that. Yeah,
Mm-hmm.
beyond, it's coming in my head beyond the point of relevance, but still it's
Yes.
coming in my head. Like
Yes.
I want to wash my hand, I want to wash my hand again and again, I know it's clean, but still I again want to wash my hands. So these things are getting even more exaggerated during this COVID era. And
Yes.
fear of being contaminated. So yeah, these are some of the problems that are becoming, we are seeing more and more during this period.
Mm-hmm.
And yeah, I can only hope that it will help in reducing the stigma. There is only hope. I
Yeah.
hope for that.
Yeah. I mean, it was jarring to me too when I read that the reported cases increased by 20%, and we know how many are reported, right? It's such a low
Yeah,
number in the first
exactly.
instance. Yeah.
Mm.
Priyanshu just mentioned, he mentioned that there is a PPT.
Yeah, okay. There are a few pictures I
Okay.
took during my COVID posting.
Yeah.
I wanted to share, that's why. Yeah.
Yes, definitely. This would, we are
Yeah,
waiting for it. Yeah.
these are this picture, as you can see, these are the women.
Yeah.
Some of them were pregnant, some of them already gave birth to this tiny cuties. So and they all became negative, you know, their report became negative and they are ready to go home. So this is
That's
one of
great.
the, yeah, this is quite a,
So
you
cute.
know, a great feeling to give to tell them that you guys are negative now, you can go home, you know, you
Yeah.
and your baby is negative. So this
Yeah.
is something I experienced. I'm really glad that I got the opportunity. And
Yeah.
this baby, it was he it, he was given birth by a covid positive woman, and
Mm-hmm.
he was fine, he was okay, he was doing good, but without a mask because there was the mask for
Oh.
his size. But yeah, eventually he also became negative. So yeah,
Yeah.
I just wanted to see how peacefully he's sleeping. No worry for the pandemic. This is another baby, and this was one of the sibling of a twin pregnancy, huh?
Mm-hmm.
His another sibling died because of complication, but he could survive through this. And yeah,
Mm-hmm.
he's a fighter. I just wanted
Oh,
to
so
show.
cute.
Yeah, this is me. The last day of
Wow.
my COVID duty. Yeah, so
Wow.
that's it.
So how long were you in duty?
Yeah, I had to be there right from 7:30 to 3:30. It's an 8-hour duty for 7 days.
Mm-hmm.
I had to be there. I was posted for 7 days.
Okay.
Yeah.
And 7 days in GMCH, is it?
Yeah, eight for 8 hours, 8 long hours. Means it was really difficult, you know, wearing the moment you start wearing this PPE kit, you feel like drenching with sweat. And
Yeah.
yeah, for me it was good because I went upstairs. It was in the third floor,
Yeah.
where my ward was. And because I used to forget about my own misery after seeing these pregnant ladies fighting so toughly, you know, for
Yeah.
this
Yeah.
against COVID.
Yeah.
This I want to call it a monster.
Yeah.
And
Yeah. Of course.
yeah, it gave me courage to see these ladies, you know, fighting for their life, for their children. Yeah,
Yeah.
so it was
No, I mean,
a good
this
experience.
is great. I mean, do you get a chance to come out of the kit during that 8 hours, or it's just a continuous 8 hour
No, no,
attire?
it was a
You
continuous
have to.
8 hours. Some of
Okay.
the guys who get, you know, dizzy or tired,
Yeah.
they went out. But I felt that it will be risky, not for me, but for my patients, because they were,
Right.
many of them were critical. You know, post cesarean cases were there. You
Yes.
know, so yeah, I managed. I don't know how, but you know, God gave me the strength.
No, I mean, I'm glad that. Thank you, Priyanshu, too, for reminding that we should share the PPT. I think these are great images. Thank you again for your work. And I think for people, they'll just know that how much more frontline workers are dealing with. And, I'm not saying it's okay for everyone else, but definitely the amount of stress that some people are
Yeah.
going through
Out
against others, it's just, yeah.
Yeah, out of us, we were 9 posted in the building, and I was in third floor, as I said. Out of 9,
Mm-hmm.
one became positive after the whole course of 7 days of posting, and he
Okay.
was my colleague. He's my colleague,
Okay.
so I hope he will get well soon. So
Okay.
yeah, I want to mention about
Yeah.
him. And
Let's
yeah,
hope he's safe now.
yeah, yeah. Then the next slide, I just prepared only a few points. The next
Yeah.
slide, please.
Yeah,
Yeah,
sure.
so these are just the points I want to just read out, like how to deal with the psychological stress associated with COVID-19. First, we need to acknowledge our feelings. It is better to ventilate, you know. We should not keep it like, we should not suppress it. We should acknowledge the feelings, that how we are feeling, how we are concerned. And it is very important to share, you know. It is social distancing, right? It is physical distancing, not emotionally. We should distance ourselves, which is
Mm-hmm.
important. And again, awareness of realistic and reliable resources. Like there are lots of misnomers, lots of misinformation which we should avoid, and only rely on the reliable websites like WHO,
Yes.
ICMR, like that. And thirdly is avoid speculations, like apprehension, what will happen next, and this kind of things. And yeah,
Mm-hmm.
as I have already mentioned, social distancing and hygiene is very important.
Mm-hmm.
Next slide, please. Yeah, and yes, we should be physically active, as I have said.
Mm-hmm.
Exercising and a balanced diet is very important. Taking adequate amount of water. You know, dehydration may also make us irritable, you know, anxious at times. We
Mm-hmm.
ourselves don't understand, but it happens. And
Mm-hmm.
then we should not only take care of ourselves, we should also help our neighbors, our children. If someone say came back, as you have pointed the relevant question, that sometimes people coming back home from quarantine, from after becoming negative, they are like criticized, they are stigmatized. So we should work on that. At I think government should take proper initiative to educate people regarding this. And
Yeah.
there should be proper like laws, and now at times I really feel, I hear about all these things about stigma and stigmatization and all this. There should be laws to avoid this kind of situations. And
Mm-hmm.
yeah, rumors should be spread. Yeah, this is quite common, we all know. And
Yeah.
we should
WhatsApp
balance work and
messages. Yeah.
leisure. Yeah, these are the things. And the last point I have, last slide I have, yeah, communicate with empathy. I will just read out, okay?
Yeah.
Care for
Sure.
the
Sure.
elderly. Yeah, old age, old age is very
Yes.
vulnerable. uh,
Yes.
and the mortality rate also increases with age.
Yes.
More
Mm-hmm.
than 65
Definitely.
years, the risk of mortality is quite high. But at the
Mm-hmm.
same time, it is not that younger generation doesn't get complications. They will not have problem, they don't die. These are also misnomers. They may also become serious, so we should all take it seriously. And like, yeah, the next point is cultivating hobbies and routines, I have said. And cultivate approach towards spreading information, appropriate information, I must say. And
Mm-hmm.
lastly, chat and socialization, which is also
Yes.
important in this pandemic era. Yeah, that's it
Yes.
on my side.
Yeah, I think these are great points, and it kind of succinctly sums up what we were talking about, right? All the tips
Yeah,
that you
yeah,
gave throughout
exactly,
the
exactly.
session. I think we can actually put it up probably in our Facebook page, so that people can actually access it and see what are some of the things that they can
Yep.
do.
Mm, sure.
There is another question: how is a psychiatrist dealing with the pandemic? Have you faced any kind of mental issue during this?
I want to make it like, I have a doubt whether it's about ourselves as, or it's for others, like mental illness of patients, right? Of others.
Yeah, I think mental for the doctors, mental health of doctors.
Okay, mental health of doctors. Yeah, we have
You're
panel.
breaking again,
Okay,
Nilofar.
in actually, okay,
You're back.
sorry, just
No,
wait.
you're back. Okay.
Am I visible now?
Mm-hmm. There's a lag in your video. I mean, the frame is stuck.
Okay, just hold on.
Yeah.
Okay, okay, okay. Now am I there?
Yes, you're there. Go ahead, please.
Yeah. So for this, there are special panels, panels of psychiatrists, like few of the psychiatrists, our senior psychiatrists were appointed to give proper counseling to the patients as
Mm-hmm.
well as to the doctors. No, in there are around one, two, three, around four buildings in GMCH only for COVID positive patients, where where doctors are posted,
Mm-hmm.
for duty for a particular period of time.
Yeah.
And yeah, and not only here, but also in the other centers, like those of in Khanapara and other places. There also there's appointed one or two psychiatrists to counsel the doctors, as well as take care of the mental health of the patients. So this is the initiative taken for this purpose.
Okay. Okay, I'm glad to hear that, because it's of extreme importance to take care of the people who are taking care of us. So I'm glad that there is something going on in that direction. Um, I would have actually loved to go on talking with you, but unfortunately, I need to get back and log into work. So Mridusmita, she's here already, and she would be carrying forward the session with you.
Yeah,
Thank you so much for the discussion. I think you gave some great tips. The PPT is extremely helpful. I think we should definitely put it up on Facebook for everyone to see.
it's really
And
nice to have it. chat with you. Thank you
Sure.
so much.
Sure. And since you're in Guwahati, when I visit, I'll definitely try and connect with you whenever the
Sure,
borders
sure.
open up. But yeah, great. Thank you. Thank you, everyone. Bye-bye. Have a great
Bye.
Thank you.
good night. Yeah, bye.
Bye-bye. Okay.
Again.
Hello, ma'am. As we have known about very much about this pandemic, this mental health issues, I have a question that এতিয়া আমাৰ এনেকুৱা হৈছে পেণ্ডেমিক যেটো COVID-19 টো এটা বেমাৰ হিচাপে নহয় মানুহৰ ভিতৰত ভয় হিচাপে সোমাই গৈছে we everyone know that যে এইটো এটা হ'ব কিন্তু I'm already prepared for it যে হলেও মানে I'll face it এতিয়া বহুতৰ হেনেকুৱা হৈ গৈছে কিন্তু বহুতৰ মনত এটা এনেকুৱা হৈছে যে এইটো এটা ভয় যে হলে কিবা এটা হ'ব যে stigmas are there also কিবা এটা হ'ব কিন্তু ভয় হিচাপে কিছুমান mentally strong to face কিছুমান আকৌ মেন্টেলি ষ্ট্ৰং নহয় গতিকে আপোনালোকৰ তাতেও হয়তো এনেকুৱা পেশেন্ট বহুত আহিছে যিবোৰ মেন্টেলি অলৰেডি ষ্ট্ৰং তেওঁলোক সোনকালে হয়তো ইমান ইস্যু নোহোৱাকৈ ভাল হৈ গুচি গৈছে ৰিলিজ লৈ কিছুমান আছে যিবোৰৰ বেমাৰটোৱে নহয় মেন্টেলি উইক ইমান বেছি যে হেতুৱেহে বেছিকৈ মানে মানুহজনক উইক কৰি দিছে আৰু হিল হওঁতে অকমান টাইম লৈছে তেনেধৰণৰ যিবোৰ কেছ আহিছে আপোনালোকে কেনেদৰে ডিল কৰিছে
Okay, so yes, ito hosa hoy. You are very right. Je manuhor juntu mental health ase. It has a lot to do with our immune system. Our immunity to aru our mental health to bahut related hoy, interconnected hoy, biologically also. Aru mane they are directly kind of they are I can say they are inversely proportional. Better is the they are directly proportional. Sorry, better is the mental health, good is the immunity. So etia enka hoise je there is kind of a chaos everywhere, as we can see lots of accidents happening in different places. মানে accidents হৈ আছে বেছিকে মানুহৰ state of mind to ঠিক নাই মানে stable নাই হেতু হৈ আছে and plus yeah about the patients henokwa hole look after a particular period of time, say 9 days, even if say not 9 days, যদি ধৰক আপোনাৰ ঠিক হোৱা নাই হা নেগেটিভ হৈ যোৱা নাই 9th ডেট আমি আকৌ ৰিটেষ্ট কৰাও যদি ঠিক হোৱা নাই then we keep the patient, okay, we keep the patient in the hospital আৰু আমি every alternate day আমি টেষ্ট কৰাই থাকো যেতিয়ালৈকে নেগেটিভ নহয় হা সো তেনেকে আমি হেৰি কৰো আৰু সেকেন্ডলি যোনটো মেন্টাল হেলথৰ যোনটো প্ৰবলেম হয় কাবা এংজাইটি হয় কাবা বহুত স্ট্ৰেছ লয় সো being if they are in GMC, I know about GMC, so jodi hote GMC thake then we from the psychiatrist side go to visit them. Enokwa hoise I want to share one example. When I was posted in during my duty, I was in the 3rd floor. I got a call from there are two zones, red and green zone. Green zone to asle jot mane they are the coordinators, tate administration, medicines, hiblak intend kora hiblak kam hiote korisla. Red zone is the area where there were patients and us, the caretakers, means us, only us, not the attendants. So henokwa I got a call from the 4th floor that a person is not keeping well, you need to go and see. So I went and I checked the patient. মই আগতে ইনিশিয়ালি ভাবিছিলো তাৰ ব্রিদিং ডিফিকাল্টি হৈ আছে নেকি কিবা হৈ আছে অক্সিজেন কমি গৈছে নেকি I checked everything and then I realized that he is having a panic attack and yeah the more he is suffering from palpitation, sweating, the symptoms that are similar to a phase which occurs during মানে hypoxia jete oxygen komi jay no etu phase tar pisot mane I had to educate him, you know, and while doing that every other person in the room also started asking many questions to me. I don't know, they didn't know that I am a psychiatrist. They just know that I am a COVID doctor aru goisu mane COVID kiba related problems sabole, and everybody was asking questions just for the sake of having mental satisfaction, and they were commenting also, বাইদেউ এনেকে কৈ দিলে আমি বহুত ভাল ফিল কৰো, আমাৰ আমি এনেকে কলে আমি বহুত ভাল পাও, আমাৰ মানে I realized that it is so important to talk and make them understand about the nature of the illness. And assurance, most importantly, assurance যে আপুনি ভাল হৈ যাব, আপোনাৰ ভাল হৈ যাব, at one point of time you will get well, whatever it is, you will get well, and if not, then we are there for you. This is called assurance. So this helps a lot. And only after talking, I think 60 to 70% of his symptoms came down. So I didn't prescribe any medication. Pisot moi disu likhi disu jetia lage khabo aru, but I gave him medicine for anxiety, not for any other anything else. So yeah, I think it is important. Mental health is very important, and counseling helps a lot. Yeah.
সেইটো টাইমত আই গেছ কমফৰ্ট যোনে দিব পাৰে, মেণ্টেল এচিউৰেঞ্চ সেইটো বেছি ইম্পৰ্টেণ্ট হৈ যায় বহুত সময়ত। মানে পেচেণ্ট এজনক যদি ডক্টৰে কৈ দিয়ে যে আপোনাৰ একো নহয়, ভাল হ'ব, that helps a lot.
Yeah, definitely it helps a lot.
Okay. We have one question from Milin sir. Sir, you can just unmute and ask your question. Hello.
So a couple of questions, Nilofar. So number one, when you are in your PPT, right? So how long does it take you to prepare?
Prepare what?
All those PPT, you are going to work now. How long does it take you to, get ready?
Yeah, this is a nice question. This PPE kit, right? Yeah, it used to take around it is personal protective equipment kit. Personal protective equipment kit. Yeah, it used to take around 30 to 40 minutes. Yeah, just to
wear that, and
yeah.
I'm sure, can you show me? So the picture one more time if possible. So like juta shuru sake cover pinibo lagibo na, juta suta, how do you?
Obviously, yeah. It used to take a lot of time. And one more thing, this process is called as donning. There are two things, donning and doffing. Donning means wearing this PPE kit, and doffing means removing the PPE kit. So I want to add a very important point. If any one of us sometimes need to wear this PPE kit, considering the situation, then this donning doffing process is very important to keep yourself safe, because if you are safe, then only you can take care of others. That's why it is important, to keep yourself safe. So donning to there are helpers who can help you in donning, because you are at that time.
But what is donning?
Sorry?
But what is donning?
Donning, I said donning means wearing the PPE kit. Donning means wearing the PPE kit. And there will be people to help you. But and people think that donning is important, but doffing is more important. Doffing means DOFFING. Doffing means just removing the kit, yeah. And you should do it very, very meticulously. And this is the place where many people fails and get himself or herself exposed to the virus. So there are certain steps. I will share it with you guys, the proper way of doffing. And yeah, this will help. I believe this will help many people.
And after doffing that PPE kit, it is again sanitized and it can be reused, I guess.
No. We used to it is kind of a use and throw thing. We used to throw it away, like we used to keep it in the dustbin. Yeah. And
isn't it like 700 rupees or something like that? Quite expensive, right?
No, it is 3,000, I guess.
1,000 every day.
I checked the price once, but I think government is taking, I don't know. I can't comment over this.
Okay, okay. Because last I heard it was like 750 or something.
Maybe the government take it in a discounted price, but yeah, it it is quite costly.
Maybe
Yeah.
the price depends upon the quality also.
Yeah, exactly. And sometimes when the quality, we don't get the choice of picking up a good quality PPE kit, it is very, very difficult. Once I developed rash all over my body, And another time I had an experience I want to share after doffing, actually, after removing the kit, the ward boy sprays you completely with disinfectant. Okay. And after spraying it, there was no room to change, and I was like that, covered with the disinfectant for around 10 to 15 minutes, which gave me a very bad rash once. And I had to just, because that was the third day of my whole duty, I was afraid that if I will be able to make it or not the rest of the days, but somehow, yeah, I became better.
So what is the process, doffing process?
ডফিং টো মেইনলি আপোনাৰ এনেকে কৰিব লাগে যাতে বাহিৰৰ বস্তুখিনি আপুনি টাচ নকৰে, মানে you don't touch it, the outside and the inside remains you know contactless, like there are certain steps. First, removing your this face shield, and then the gloves. I used to wear 3 gloves, okay, and the first glove, I had to sanitize it and then remove the chain. The whole neck area is like taped, it's like a space suit. I had to remove the tape and then unchain myself, and then, without touching the kit from outside, the suit from outside, I had to pull it down, down. This is like a raincoat kind of thing. You got it now. It's like a play suit, one piece kind of now. So yeah, and then after you remove it as a whole, you remove the shoe. There are separate sock kind of thing, which you need to put over, and you need to remove the socks. Okay, along with it, you need to remove the socks, and then you remove one of the gloves. You throw one of the glove, one pair of glove, and then you remove your face mask and your hair mask, goggles, and then again remove another gloves, like that. This way, when your hand becomes clean again and again after removing layers of gloves, like I used to wear 3, I said already, then there is less chance that you touch your face or the areas in proximity with infected hands. So this is important. Okay, and do it very slowly. There is no rush. We need to do it slowly so that we don't touch here and there and everywhere, and get ourselves totally messed with the infection. Yeah, so like that. And the last part was removing the
So your what do you call this? Removing also must be taking you 45 minutes.
No, I used to take 15 to 20 minutes, but yeah, some people used to remove it very fast, like 5 minutes, chick check chish, finished. But this is dangerous, I must say. Yeah.
Okay.
Yeah.
The other question I have was,
Yeah, Melinda.
so I was recently seeing some video in Delhi hospital, some one of the best hospital in Delhi, and they're showing some video where there's people there and there's dead body lying there,
Okay.
and they
Yeah.
were
Yeah. I
saying
also saw
that
that.
nobody in the room for like 15 minutes or whatever. There's nobody. There's no medical people. There's nobody. There's people lying there. There's dead bodies there, and it looks so depressing and sad.
Yeah, I understand.
What is the condition in GMCS?
Not like that, Melinda.
Is it?
GMCH, huh?
Okay.
The management is,
Man, that's what my
I
question is.
must say, I'm proud
Yeah.
of, I'm proud of Assam. I'm proud of Assam
Okay.
that the government as well as the health team is managing it very well. I'm not telling about myself, not praising on myself, but yeah, they all are putting a lot of efforts. And yeah, situation is not at all same here. My God, means we all are like we all are allotted our own duration our own
Mm.
period of work and our own floor. And like it's quite systematic what I found. Initially I was like ki kori moi, in fact I am dealing with
Mm.
pregnant ladies and I am a psychiatrist, what I will do. But it's not so, you know.
Mm.
Doctors come, the gynecologists, obstetricians come, and they visit the patients regularly twice. And as I said, there are two zones, na, green zone and red zone. And we all the floors has its personal mobile which stays in that floor only. And we can connect via this to the green zone, and the green zone is connected to all the departments of Guwahati Medical College. So that if there is any emergency, like even if there is itching, say for example a person is having itching or some eye soreness, then directly we can contact the green zone guys, and they will directly connect us with the department. Even we make sometimes videos and send, and then they see and they come to visit the patient as soon as possible. So these are the ways, I'm just giving few examples, these are the ways patients are treated in GMCH. And as far as I'm concerned about my experience, it is good, it is quite satisfying. Yeah, but there will be I must say there will be setbacks, always there will be some setbacks, which yeah, we will take care of as much as possible. Yeah.
So for 8 hours where you were there, so there's no bathroom breaks, there's no food breaks, right? When you're
Huh?
gone for 8 hours, meaning, so when you're
Mm-hmm.
gone for 8 hours shift, like when you're
Yeah.
in PPE kit,
Mm-hmm.
so there's no bathroom breaks and there's no food breaks, right?
No, nothing. No water also. And like
Okay.
no even we cannot go to the washroom. But
Yeah.
I never felt the necessity, because we used to sweat like anything, you know, in that kit, and there is no AC out there, because yeah, it might
Oh.
spread the virus, I guess. So they are totally shut down in all the floors. So yeah,
Mm.
sweating used to do that work, you know. I never had to go to washroom.
So no dieting needed, huh?
Sorry.
Or no exercise and dieting needed for you those days. You're already in a hot suit, like a hot
Yeah,
yoga, and working,
y-
you know.
exactly. And moreover,
And
like
actually,
sorry.
go ahead.
Ha. Yeah, if wearing that PP kit, if you sit, you think, okay, let me take rest for half an hour, say, after all I'm staying here for 8 hours. But for me it happened that even if I sit for 10 minutes or 5 minutes, then I develop that feeling, oh, I'm feeling so itchy, means I wanted to scratch here and there. Um, but as much as I used to keep myself busy, I didn't get those kind of impulses, like, oh, I want to remove my mask, it's so hot, it's so hot. When you're busy with something, you know those things doesn't come up. So yeah, that helped, I guess.
And when you work for 8 days, you stayed over there only, right? You didn't come back home.
Mm. No, I can't, I can't, I can't dare to come home, because I was kind of, you can say I was exposed out there, and maybe it's my immunity that protected me, because at some point of time you feel like there is no barrier, while removing your kit and entering the green zone without the kit, even without the mask, after the disinfectant guy disinfect you, then you feel that, okay, more to expose holo aru mur mask nai. So yeah, you can't I didn't come home. I didn't come home, nor in the hostel. I was there in the quarantine zone only.
So there's a bedroom and nice facilities for you to rest.
Yeah, yeah, it was kind of okay. Though the food is not good, but it's okay, it's satisfying, like fine.
And they made beds and all available in the hospital itself.
Yeah, there are doctors room actually which are made vacant.
Okay.
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 Yeah, like that.
Thank you.
Okay.
Back
Thank
to
you,
you.
sir. Thank you, sir. Ma'am, already I have said that patients who are positive might be there now. We are live now in FB. Might be their family members who are right now positives. They are watching it. When a person gets infected, whole family suffers. যেতিয়া ফেমিলিৰ এজনৰ কভিড হয় ভাল হৈ আহক চিটুৱেশ্যন যিটোৱেই নহওক কিয় যেনেকুৱা ষ্টেজতে নাথাকক কিয় কিন্তু ফেমিলি মেম্বাৰ্ছখিনি দে আৰ অলৱেজ ৱৰিড এবাউট দেম গতিকে তেওঁলোকৰ পেচেণ্টজনৰ যিমান মেণ্টেল ব্ৰেকডাউন হয় বা মেণ্টেলি ষ্ট্ৰং হ'বও পাৰে কিন্তু ফেমিলি মেম্বাৰ্ছখিনিও সিমানেই মেণ্টেলি চাফাৰ কৰে
Exactly. হয়,
গতিকে আপুনি কি ক'ব বিচাৰিব তেওঁলোকক কিবা মেছেজ ডেলিভাৰ কৰিব বিচাৰিব ফেমিলি মেম্বাৰ্ছখিনিলৈকে মানে তেওঁলোকে কেনেদৰে যেতিয়া পেচেণ্টজন ঘূৰি আহিব ৰিলিজ লৈ তাৰ পাছত কেনেদৰে ৰিয়েক্ট কৰিব লাগে একচুৱেলি যদি ঘৰৰ মানুহখিনি পেনিক হৈ দেখুৱাই দিয়ে পেচেণ্টজন মে বি আকৌ বেছি পেনিক হৈ তেওঁ আকৌ পেনিক হৈও যাব পাৰে গতিকে কেনেদৰে ৰিয়েক্ট কৰা ভাল কেনেদৰে ৰিয়েক্ট কৰিব লাগে একচুৱেলি
Okay, এইটো মই দুটা এৰিয়া ডিভাইড কৰি মই কম হা এটা মানে the rules that we should follow and secondly the from emotional point of view one to avoid the infection and other to cope up with our emotions so first যেতিয়া আমি discharge কৰো এটা patientক even after they become negative we ask the patient for 7 days to stay at home and keep the room ventilated properly ventilated wear the mask continuously in presence of others okay আৰু এটা distance maintain কৰিব আমি advise কৰো ঘৰত থাকিলেও অলপ নিজক self isolationত ৰাখিবলৈ advise কৰো for 7 days so এইটো important হয় যাতে মানে patientটো নিজক recover কৰিব পাৰে okay staying not working outside not overstressing himself or herself in that way he can take care of himself or herself and at the same time belekoru mane jate spread no hoy infection to hitu sabo pare because ebar jodi report to negative ahe amar duta dhoroner mane result ahe eta hol rapid antigen test ko ami aru eta rt pcr juntu pcr test rapid antigen test to sensitivity to relatively অলপ কম compared to RT-PCR এনেকুৱা নহয় যে সদায় মানে ভুলে আহে but সব বস্তু এটা relativity চলে ন so this rapid test অলপ relatively কম sensitive so it's better to take precautions for 7 days because finally at one point of time your body your immunity is going to kill the virus anyhow it is going to end যেনেকুৱা আমাৰ পৰীক্ষা আহে ক্লাস 10 or মেট্ৰিক পৰীক্ষা দিও আমি ক্লাস 12 পৰীক্ষা দিও কিমান বেছিতকে বেছি 5 দিন হে চলিব 7 দিন হে চলিব then it will get over right so that way we should make ourselves understand that this is just a phase and it will pass over it is not going to last forever we are going to fight it and win this war আৰু secondly যোনটো emotional point of view পৰা থাকে empathy comforting the patient is very important comforting the patient welcoming him giving a warm welcome is important at the same time considering the well-being of self is also not something that is bad যে মই নিজক এটা ডিস্টেন্সত ৰাখিছো at least for 1 week নিজক এটা ডিস্টেন্সত ৰাখিছো মই নিজৰ মানে নিজৰ কথা ভাবিছো I am thinking about patient also okay this is not bad because if you are fine until you are not yourself well you are not healthy you're not fine how can you take care of others this is the point like family members ketak nijok healthy thakibo lagibo no in order to take care of others in order to take care of the patient so yeah this is very important you should not feel that it is selfish to isolate the patient for a few days because this is a fight this is a war we are facing and we should be like emotionally strong about it at the same time stigmatizing I don't support it definitely we can't support it at all yeah so this should be totally well balanced I believe I hope you got my point
okay
Yeah.
Ma'am, when it comes
So
to
I have one
family,
more question.
okay,
Ah.
sir.
One more question is that since you have been working with LGBTQ community,
Yeah.
right?
Yes. Yeah.
Transgender.
Hmm.
So did you have any, how is the transgender community treated in the if there's any, which area they were placed? Were if the Hijra community, were they kept with the women, or they have a separate space, or with men?
Sorry,
Transgender or
I'm not
third
getting you,
gender
Belinda.
people.
Yeah. Yeah.
So if there is, suppose there is
So.
a third gender or a transgender patient,
Ha.
okay,
Ha.
is there, where are they kept? Are they kept with the women or men, or for the
Okay.
gender neutral people?
Okay. Okay,
Yes.
Melinda. So for that, look, where I worked, all were women, and maybe I will not be able to give adequate
Sure.
information to you about this. I'll have to ask my colleagues for
Okay,
that,
that's fine.
because I'm not 100%
Sure.
sure. But yes,
Yeah.
as I said, once or twice I have been to other wards to take care of patients with people with psychological issues. I have seen both male and female, they were being kept together, kind of. There is no separation as such, but still I will have to confirm, as I have said that I
Okay.
was
Okay.
posted in the ward
Okay.
where
Okay.
there were only females. Yeah. Mm.
Okay.
Thank
Okay.
you, sir.
All right. Okay.
Mm.
And I had one more question, but I forgot. So
Yeah, Melinda.
the second question I forgot right now. So Madhusmita, you, when I remember it, I'll again.
Okay. Okay.
Sir, you can go ahead. It's okay. Okay. So we have already talked about family patient or family কথা পেশেন্টৰ কথা যেতিয়া আহে পেশেন্টজন আমি নৰ্মেল পিপল আমি বাহিৰলৈ গ'লে হয়তো ইনফেক্ট এক্সপ'জড হ'ব পাৰো ভাইৰাছত আমি ভাইৰাছত এক্সপ'জড হৈ আমি ইনফেক্টেড হ'ব পাৰো বাট when it comes to doctors you are the frontline warriors you always have to go to your duty so you have the মেক্সিমাম আপোনালোকৰ যিটো মেক্সিমাম আপোনালোকে এক্সপ'জড হোৱাৰ চান্সটো বেছিকে থাকে মেক্সিমাম চান্স ইউ হেভ so we have a question from Priyanshu that how is your family reacting to your work are they scared or
Yeah. Actually, they are scared more for me, I think. Yeah, obviously they are worried about me.
Yeah.
And this is good on my part that I don't have children yet, so I don't need to worry that I have children at home and I will take the virus and infect them. So this fear is not there for me. But yeah, I have seen my colleagues worrying a lot that they have children, they work and they go home every day. They are apprehensive if they are going to infect others, so definitely this is a great concern for us. And mostly what personally, if you ask me about me, when I was continuing my duty in GMCH, then I stayed in hostel so that I don't bring the disease home. So I stayed in the hostel even though there were lots of positive cases out there. I made my mind to stay there till this phase is over, but it's not getting over. Because we'll have to reconsider ourselves, something
Okay.
new to take
Okay.
over.
So when you were on COVID duty, then you have maximum 1 week of work, then 1 week of quarantine period.
Yeah.
So you
Yeah.
have to stay away from your home about for 2 weeks, 15 days. So
Yeah,
আপোনালোকৰটো
exactly.
ধৰক as a doctor যিখিনি আপোনালোকৰ ডিউটি থাকে towards family, towards your আপোনালোকৰ নিজৰ প্ৰাইভেট কামো বহুত থাকে যিখিনি আপোনালোকে aside কৰি ডিউটি কৰিবলগীয়া হয় and we had another question from Priyanshu again. Don't you get what makes you 1 second, sorry. What makes you motivated to go to your work? And don't you get reminded of all after the work আপোনাৰ যিখিনি কাম বেলেগ কৰিবলগীয়া থাকে, and don't that stop you ever?
Yeah, actually, this kind of things comes in my mind many a times, but yeah, once I'm committed to my service, I believe I will have to do it. Even I used to tell my mother যে এতিয়া তো মই হয়ে গলো ডক্টৰ ন, এতিয়া নকৰি মোৰ বেলেগ একো মানে হেৰি নাই, I'll have to do it. I will have to do it because maybe this is my destiny, and I'm glad that I'm happy to serve in this way. So yeah, mane I consider it that way. I just believe this is the only way. Yeah.
Okay. So there's another question from Priyanshu. I guess he can ask. Just unmute your audio and go ahead, Priyanshu.
Yes, ma'am.
Okay.
I'm Priyanshu. I'm like kind of very much motivated, like how you're dealing with everything. Like you told me 40 minutes of PPE kit, then staying away from family for 8 days, like how much you are dealing. Like I myself is in medication of depression and everything. Like, but right now listening to you, I'm kind of very much motivated. Like you have been through so much, but you're still strong. So my question is, like, being a psychiatrist, have you ever like tried to change the mindset of the people near your area, like how they deal with like towards mental health?
Yeah. Means again, it's a very difficult job at times, because particularly in India, yeah, in many societies, there are lots of taboos regarding mental illness, and why once a person come to know that a person is mentally not keeping well, there are lots of taboos. That's why, believe me, mane, the picture we see here is just an iceberg ka jo bolte hain na, tip of the iceberg. It's like that because many people hide it, and many people hide it definitely because of the taboo. And yeah, I try definitely. The question from your side, whether I try from my part to bring awareness. Yes, I try it, and I think we need to do it on a wider scale, like spreading awareness in communities, in communities, in schools, in colleges. In that way only we can make it happen. তেতিয়াহে বস্তুটো ইমপ্লিমেণ্ট হ'ব। আৰু এইটো ইম্পৰ্টেণ্ট হয় because once we are mentally strong, when we are mentally well, then only we can do well in other areas. And one more thing, it's not something a big deal to have psychological issues. Many people have it at any one point of time. Mane, around 2/3 of the patients, 2/3 of the population suffer from depression. So it is so common. Around you can say more, around 60 to 70%, maybe more than that. Now too it will increase to to a much higher level, I believe, after this COVID pandemic. So yeah. And talking about mental issues, we should motivate people to talk about mental issues, because once we kind of ferment it inside ourselves, it takes a bigger form. And that's why suicide is becoming so common these days. People don't ventilate themselves. They don't talk to their family. Even their family leave about coming to a psychiatrist. They don't even feel like going and chatting about the mental issues to their friends, to the family, because there's a myth that, oh, ki buzibo no mor kotha, they will not understand. So yeah, for these things I believe that we have to just spread the awareness at a wider scale, at community level. Yeah.
Okay, thank you, ma'am. We have more questions from Milind sir. Sir,
Yeah,
you can go
Melinda.
ahead. Hello.
Yeah, Melinda.
Linda, you're still on mute.
Yeah, Yeah. Sorry. Ventilator. Do you still have enough ventilator, or all the ventilator are already used? What is the situation right now?
Huh? Sorry?
Ventilator. Is there enough ventilator available in GMCAs or in Guwahati, or most of the ventilator are used? And there's, what is the situation right now?
Yeah, so ventilators are available. Okay, so as I have already mentioned that there are around 4 to 5 buildings, COVID specialty building, I can say, and the super specialty building that is there, super specialty COVID ward, which is there just in front of the main entry of GMCH. So that is facilitated with ICU beds around 40 to 60, I guess, and all for COVID positive patients, and more are coming up. The numbers are increasing. Yeah, the numbers are increasing. So yeah,
Yeah. So
yeah, yeah.
when you say number are you increasing, is it the number are more, or they're recovering faster, or they are more serious critical condition now?
Yeah, look, Melinda, means recovery rate is getting better. Okay, day by day, it's changing. It's a changing numerical. Every day it is changing, but it's getting better, of course. And when the pandemic started, early, it started first in China and then went to the Western countries, Italy, US. At that point of time, we didn't know much about this virus, but now as the days are passing, lots of experiments and lots of studies are going on, and we realized we understood many things, which at that point of time when COVID was peak in other countries, they didn't know. That's why the recovery rate, or you can say the mortality rate in India is less. And this is the good thing that our government did by giving the lockdown during those phase. It kind of delayed the pandemic, and the good chunk over this is that now we know a lot about this virus, like how it deteriorates, how it causes the deterioration in health. Like we need to give it creates blood clots in the lungs. We most of us know about it. Now there are new researchers that discovered that there are blood clots in the lungs, which causes a sudden decline in the oxygen, sudden fall in the blood oxygen level. And for that we give blood clot dissolving agents like aspirin, heparin we are giving. And then there are antivirals that are coming up, reltemivir and other antivirals. Along with that, there is plasma therapy, which has some evidence of which has evidence of improving the condition of the patient. And one more important thing, I want to mention that even if someone is thinking that, yeah, I might have got the infection, and they are in a remote place, they need to come, they have a breathing difficulty, please do check your saturation of oxygen, blood oxygen, that is SpO2 we call it. So we need to check it. We can check it via pulse oximeter, which is available in most of the pharmaceutical shops. And secondly, only giving oxygen supply can save lives. Many people die suddenly because of this sudden fall in oxygen level in the blood, and that's why we call it happy hypoxia. Happy hypoxia means low oxygen, means the person doesn't even know that his blood level of oxygen is decreasing, and things are going wrong. It happens in such less period of time. So more stress we should put on this. Okay, that's why
And it
I
should be
share
more
this
than 90,
information.
right?
Huh,
It should be more
Melinda?
than 90. It should be more than 90, right? That
It
whatever
should
the
be,
oxygen.
yeah, is the SpO2 should be more than 95%. Say if it is 93%, 92%, you should be concerned, and you should go to, it's better to go to visit a hospital, and because the drop is very sudden, when it will become, say from 92, when it will become 80 or 82, we don't know. So this is kind of
Okay.
an alarm, and I think
Okay.
people should know about it. It can save a life. Yeah.
Okay. All right. So the other thing I was thinking about, Regarding plasma therapy, is plasma easily available now? What is the situation in Guwahati?
Yeah,
People are donating enough, or no? People are not donating blood so much.
even
People who are
even today also there's kind of a meeting that was held in GMCH auditorium where our honorable health minister, I guess he also made a visit, and which motivated the also the doctors, the frontline warriors who became COVID positive to donate plasma. So like this means lots of awareness is being spread regarding this the benefits of donating plasma. And I think we all are working together to increase the number of plasma donation. Yeah,
okay.
it's kind of a
Can
ongoing
it be
process now.
made compulsory that those people who feel better before they leave the hospital they donate some amount of blood? Can it make
Melinda,
compulsory or not necessary?
oh, that will be like I am afraid if it violates the right, their personal right now. But yeah, and yeah, actually what the actual thing is, even after
Yeah.
getting positive with COVID virus, many people don't develop antibodies. Okay, only a fraction, a percentage of individuals getting COVID positive develop the antibodies, and that only helps, when they have antibody in their blood, then only their plasma mainly helps. So this is one of the thing. And yeah, people are donating. I have seen many of my colleagues also donating plasma. In fact, where I was working, there is a plasma convalescent center. Yeah, in fact, in the building I was working. Yeah.
Okay. Regarding this plasma therapy, last week one of my juniors' father infected positive. So and he was again a kidney patient. So he was COVID ke besi mane তেওঁৰ kidney ফালৰ hello ma'am.
Mm-hmm.
Okay, your
Yeah.
video is lagging, that's why.
Okay.
কোভিডতকে বেছি তেওঁৰ ভয় আছিলে কিডনীৰ ফালৰ পৰা হি ৱাজ আণ্ডাৰ ডায়ালাইচিছ কৰি থকা হৈছিলে গতিকে প্লাজমা থেৰাপি মানে প্লাজমা বিচাৰি মোকো সুধিছিলে মানে কোনোবা কণ্টেক্ট আছে নেকি ময়ো খবৰ ললো তেনেকৈ তাৰপিছত সি নিজেই মানে দুজনমান কোভিড পেচেণ্টৰ খবৰ পালে যিকেইজন মানে প্লাজমা ডোনেট কৰিবলৈ লৈ ৰেডি আছিলে কিন্তু কথাটো হ'ল যে ডাইৰেক্ট প্লাজমা ট্ৰান্সফাৰ কৰিব নোৱাৰে কোনোবা এজন যদি লৈ আহে গতিকে তাৰে এটা প্ৰচিডিউৰ আছে যেটা অফিচিয়ালি আমি মুভ অন কৰিব লাগিব প্ৰচিডিউৰটোৰ থ্ৰুৰে গতিকে সেই প্ৰচিডিউৰটোৰ কথা আপুনি অকমান ক'লে ভাল হয় কাৰণ বহুতে হয়তো সেইটো নাজানে প্লাজমা ডোনেটৰ পালেও চাগে যোনে ডোনেট কৰে পালেও হয়তো ডাইৰেক্টলি নোৱাৰিবও পাৰে পাব গতিকে সেই প্ৰচিডিউৰটোৰ বিষয়ে অকমান ক'ব নেকি
Okay, mainly মানে আমাৰ তাতে in GMCH and there are certain centers for plasma donation. Okay, so there are medical officers who are given responsibility for this donation thing, and one can get connected to this plasma convalescent therapy clinic which is there in the ground floor. Okay, I'm giving you kind of the address where this plasma convalescent center is there. It is in the ground floor, just opposite to just beside the emergency building of GMCH. Okay, so out there there are facilities for plasma donation. So if somebody want to donate voluntarily and people in need, they can contact. Yeah, তাতে contact কৰিব পাৰে.
এজন মানুহে যদি প্লাজমা ডোনেট কৰে how many people patient can it help? Is it one to one or one এজনৰ পৰা লৈ পেলাই it could help many?
Actually এতিয়ালৈকে Melinda, yeah, I heard about it. Melinda, look, this is kind of the laboratory thing. Na? I'm not, truly speaking, I'm not sure about this ratio, whether it is 1:1 or 1:2. I'll have to confirm about it and I'll let you know. Because
As far as
this
I
thing
know,
I'm
I
not
think
sure. Yeah.
one person from one blood, it can save many, I think, because you only
Yeah,
have to
maybe.
inject only little amount of plasma, as far as I know.
Yeah, actually it depends
Anyway, that
upon
would be good to know.
anything. Yeah, I will definitely, and it depends upon the antibody level that I know. The antibody level in the patient, in the person who is donating should be it should be high, or the antibody should be present. So it depends upon the antibody level, but the ratio I am not sure about. Yeah.
Okay. And another two questions quickly. One is that did you face any discrimination? Many places, somehow some people who are not educated are discriminatory to people who are working with COVID, right? Like Wi-Fi, whatever, they may work different way or whatever. So did you face any discrimination? That is one question. The last question is that we saw some video about how people were COVID, how the center were in Italy and all that, everybody in ventilator, very serious position. And there was a picture where saying that India COVID center and they're dancing some Hindi music and they're. So what is is it like that or what is happening?
I don't think so, Melinda. Like the second question I'm answering, had I been dancing out there, I would have been dead. I was so drained during that period. That was the question, right? People dancing out there.
Yeah, because they
Yeah.
were showing that the COVID center they were having fun because it was not so critical.
No, Melinda, here the situation, maybe there are, look, yeah, again, I want to point out something that you see there are other centers like the one in Khanapara. I know that there, the patients who are having only mild symptoms or who are stable, asymptomatic, this kind of patients are kept there. And yeah, so I'm not telling that it is easy to work there. I must not say that, because wearing the kit itself is very, very, it's a big thing. But yeah, there is not as much casualty as it is here, like in the super specialty or here. Yeah, so I don't know about since I myself didn't experience the work out there, but maybe this is in a calibrated form. But dancing, I'm not sure. But from my side personally, moi mori golo. And yeah, about the discrimination part, yes, I kind of it's you see, discrimination, it's sometimes it is perceived. You feel that you're discriminated because you know that you're exposed, like you're exposed to the virus. So yeah, I sometimes myself become too apprehensive when I get down from the car, like that. But from my experience, more henokwa discrimination about stigmatization, I didn't really felt anything like that. But yes, when I was there during the quarantine time, when I was there in the hotel, like I had two big huge luggages, and nobody was there to help me because they were not allowed to touch any belongings, our belongings. So these things were there, that do not touch their belongings, even though they were in PPE kits. Okay, the workers in the hotel, they were in PPE kits, but still they were instructed not to touch anything that belongs to us. Yeah, so those things, it stuck me. But then I felt like it's okay. I don't want to be the cause that someone get infected from me, like that's how I convinced myself that it's okay on their part also.
Thank you, ma'am. Is there any questions from anyone? Okay, I think it's time to wrap up now. Ma'am, at the end, গোটেই COVID যেটো situation হৈছে, আমি যেটো the new normal, I have already said about it, masks, social distancing, sanitization. এতিয়া আমি সকলোৰে মুখত অকল এইটোৱে শুনা পাওঁ মানে সবে অকল সেইটোৱে কথা কৈ থাকে sanitize কৰিছনে নাই, mask লগাইছনে নাই. So it's a new normal. আপুনি কি ক'ব বিচাৰিব যে যেতিয়া আমাৰ in future আমি কেনেকে মানে গোটেই নতুন সিচুৱেশনটোৰ লগত ডিল কৰিব পাৰিম, or this regarding this pandemic, what message you want to deliver to the society?
Yeah,
Hello?
exactly.
Ma'am?
I'm listening. Yeah, I just want to say that
Hello?
as I already, you listen to me,
Ma'am, I guess you're lagging.
Ridusmita. You listen me?
Yeah, we can hear you.
Hi.
আমি শুনা পাই আছো।
Na paisa, no?
There's a lag in Midusmita's connection. So
Okay.
yeah.
Yeah. The thing is, the only thing I would like to say that this pandemic is a war. It's a fight, and we will have to work together towards it, whether we are like whatever work we are doing. Some people are activists, some people are social workers, some people are doctors, some are engineers, some electrician, even the plumber. Everyone is working with the fear that, oh, if I go out, then I may harbor the infection, I may contract the infection. So we all are in a war, and yes, this phase will pass over. This will go soon, and we will again live in a world which is mask free, which is COVID free, and I believe it will get over just like Spanish flu. It also happened 100 years back, and this is quite mysterious that it happened exactly 100 years later, this pandemic. So it mesmerizes me sometimes that this is some kind of nature's cleansing process, or what. I really don't understand. I don't know, but yeah, we will fight together and we will win this war together, and this will pass soon. That's
Okay.
what I want.
Thank you, ma'am. We are so hopeful.
Yeah,
about
hope
it.
is very important.
Okay.
This is the weapon, the best weapon we can use during this phase.
Yeah. Okay. So thank you so much, ma'am.
Thank you to you.
So we're towards the end of this program. We really had a nice session. বহুত
Same
কথা জানিব
here.
পাৰিলো regarding this pandemic.
Same here.
So,
কেনেকে time to গ'ল মই গমেই নাপালো।
তাকে ঘড়ীটো চোৱাই নাই, just বহুত কথা শিকিব পাৰিলো আমি কেনেদৰে precautions ল'ব লাগে, or the stigmas, mental health. So আৰু আপোনাৰ ইমানখিনি মূল্যৱান সময় আমাক দিয়াৰ বাবে বহুত বহুত ধন্যবাদ. I'm very thankful to you.
No worries. Thank you to you guys.
Then this program's host, Basundhara ma'am, thank you ma'am for the beginning part. Then the audiences and our technical team, thanks to you. So a very thank you to all of the people.
We are losing her again. So so the thing is, ma'am, we are kind of very much motivated how everything you're dealing with, and we hope that this ends soon, and soon everyone get to meet you, like and we like most of the health team we talk to during this session. They are like, everyone is a hero right now. And
exactly.
Even the plasma heroes and everyone we are thankful for. And thanks a lot for giving us your time.
Thank you.
Thank you so much, ma'am.
Thank you so much.
Thank you so much.
Sorry, my Wi-Fi just went off. That's why I got
Okay.
We already
Thank you so much.
Thank you. Thanks to all. Goodbye.
Thank you.
Thank you
Thank you
ma'am.
so much. Okay. Goodbye.